It's 8 p.m. already, so I am on time. Do join me, and Dr. Elizabeth is also here, so do join me so that I can welcome you and then I can introduce her, and then we'll have a good live session. So guys, before joining Dr. Elizabeth Cronin, I want to first welcome you all. I hope you all are doing good, and I want to welcome you all, a very warm welcome to you all for the first episode of Let's Chat with Rats. And this episode is really very special because there are reasons I will be telling you, because before this I have done a lot of live session and I have done a lot of collaboration in live sessions as well, but with different people and from their platforms. But this is the first time I am doing live from my platform, and I am inviting people to join me. So that's why it's Chat with Rats. So first episode is about dealing with panic attacks and anxiety, and I feel really very proud that I have someone who is extremely skilled clinical psychologist and supremely talented, and who has a lot of experience in the field, and we can just say she's an expert. She is incredibly talented person, and I feel really proud that we have her for the first episode. Yes, she is Dr. Elizabeth Cronin. So let me join her. She will be here in few seconds. Really very excited.
Hello.
Hello ma'am. How are you?
I'm good, and I'm glad to be here with you.
So I'm so thankful to you that you collaborated with me. Can you please adjust the camera, because oh yeah, now
better?
it's perfect. Yeah. Okay guys, so I want first I want Dr. Elizabeth Cronin to first introduce yourself to the audience.
Sure. So I'm Elizabeth Cronin, and I'm a clinical psychologist. I have a private practice in Brookline, Massachusetts, and also in Norwood, Massachusetts. So I see clients individually, and I also work with couples, and I will even do some family work as well. So I would say that my specialty in my practice is anxiety. That just about everybody that I am working with has dealt with anxiety, and many have had panic attacks. So this is a good subject for me to talk with you about. I will also add that I'm trained in mindfulness and am currently finishing a 2-year teacher certification training in mindfulness meditation with Tara Brach and Jack Cornfield, two very prominent teachers in that field. So I bring that to all of the work that I do with my clients.
Wow, that's amazing. So guys, I'm guaranteeing you that this is something really worth watching. Do not go anywhere, just stay here and watch us, because you are going to learn a lot. And here a lot of mental health professionals are also joining. So guys, you are going to learn a lot from Dr. Elizabeth. So stay here. And before starting the session, I want to say that people have a tendency of diagnosing themselves. They just see the symptoms on Google or any post, and they see that, oh, I have this means I am having this particular disorder. So today also we are going to discuss some of the symptoms and causes, but this doesn't mean that you diagnose it yourself. You cannot assess it yourself. So Dr. Cronin will suggest you some tips and coping skills to deal with it, and it will help you a lot. But this will help you only if you are already diagnosed with any panic attack disorder or anxiety disorder. So don't diagnose yourself that the symptoms doctor is saying I all have it, and this means that I have this disorder, and I will apply this strategy. So do not do this. This is a request to you all. So I think we should start now. I request you to give a brief about panic attacks and anxiety.
Great. I'll just support your comment by saying that, right, that if you are suffering from anxiety or if you've had a panic attack, it's a good idea to reach out to your primary care physician, whatever doctor you would typically reach out to, because sometimes, occasionally, it's rare, but you want to rule out any physical health issues. You could have a thyroid problem. You could have, there could be a underlying heart issue or something. So that's helpful to do, and then get help, because one of the ways to avoid having your anxiety or a panic attack become a disorder, a more long-term problem, is to get help soon, and the sooner the better. So I just want to reinforce that this is not, our talking today is not a substitute for getting the professional support directly. So that's good.
Yeah, exactly.
So pretty much everyone deals with anxiety. Everyone deals with stress. Not everyone will have a panic attack, but we all deal with anxiety and we all deal with stress. So let me just start there by saying stress is experienced when there are things in our life that we're having to deal with, like financial challenges or deadlines for a project, that kind of thing. So that's sort of stress, and we all deal with that. It comes and goes, and not all stress is bad. Actually, some stress is good for us. It's actually helpful to be worried about getting enough sleep. That can be beneficial. It's helpful to worry about paying bills on time. That can help you avoid problems. So not all stress is bad, but we try to manage it, and we try to pay attention to it and manage it well. And then we have anxiety, which is more of a pervasive feeling that things are not okay, that something's going to go wrong, which often we don't know exactly what we're worried about, but we just have this sense of insecurity and worry. And then you have panic attacks. And panic attacks, the challenge with panic attacks is that they seem to come out of nowhere. There's no warning, and you may have never had one before and suddenly have one. And they're intense. They are very physiologically arousing. You can have rapid heartbeats, you start sweating, you can feel dizzy, you can feel tingling or numbness. You feel very, very uncomfortable, and there's a sense that often you feel like your life is threatening. You feel intensely unsafe. Many people will have one or two panic attacks and never have another. Interestingly, I had a panic attack when I was around 8 or 9 and have never had another panic attack since then. So that's a panic attack. Now, what I have had since then is anxiety attacks. And anxiety attacks are more subtle. An anxiety attack is sort of the feeling you get when you are dealing with something immediate, some immediate stressor, like you hear a loud noise in your home somewhere and you suddenly have sort of an anxiety attack where you have, symptoms of intense worry, and you feel that physiological alarm. Those usually resolve, though, when you resolve whatever the worrisome prompt is, whatever the trigger was. If you can figure out and resolve that problem, the anxiety sort of goes away. Both panic and anxiety can become disorders when you're getting into a pattern of repeatedly experiencing these, and especially if you don't get treatment for it, you're more likely to have them become a disorder. So that's sort of a general summary. Let's start with that.
Okay, so I have a lot of questions as well. people have asked me, because I have put the story that asking them to ask you whatever they have in mind, or whatever makes them confused between panic attacks and anxiety attacks. So basic thing is that the first question is, are panic attacks different from having a person having panic disorder?
Yes. So, like I said, you can have one panic attack and not know why you had it, what brought it about. But if you never have one again, it doesn't necessarily interrupt your life in any way. But it becomes a disorder when the panic attack that you had then creates fear about having another panic attack. And you can get into a lot of complications. Some people even develop something, it's rare, but they'll develop agoraphobia, where they are afraid to go places because they're afraid that they could get into a situation where they have another panic attack and they can't get out of the situation.
Exactly.
They can't get the help that they need. So that's the primary difference there.
Exactly. Okay, and coming to the second question, does people with anxiety disorders are more prone to panic attacks?
So that's an interesting question. If you've had, there are actually, you call it, things that would make you more vulnerable to having a panic attack. And that is if you have a history of any kind of trauma in your life. If you do suffer with a lot of ongoing daily anxiety, it could over time take a toll on you and make you more vulnerable to a panic attack. But there's not a direct, you could suffer with anxiety your whole life and never have a panic attack. But there is a relationship there, and there is an added vulnerability to panic when you struggle with anxiety.
Okay. Just a minute. I'm coming 2 minutes.
Okay.
I'm so sorry.
Nope, this is
Okay.
live. That's life, right?
Exactly. Okay. So this, I hope the person who asked this was live. Or if you are not live, I will put it in my feed. So do not worry. So coming to the next question. Are anxiety attacks different from panic attacks? So basically there are various symptoms which are common in both the attacks, I think, like heart palpitations, sweating. So what are the symptoms which makes them different?
More than anything, what distinguishes them is the intensity. When you're having a panic attack, you really get this. It's a very strong sense that you need help. Most people having a panic attack will feel like they're concerned about their life. In fact, it's very common to think you're having a heart attack. Another primary thing is that when you're having a panic attack, it often involves your breathing. So it's not like it's just happening in your body, but you literally start to feel like you can't breathe. A lot of people will even hyperventilate. Sometimes people will even get dizzy and fall down in the midst of a panic attack. So there's a level that if you're having a panic attack, because there's a sense that, and this is why people then become very anxious about having had one, because they're afraid if they had another one, there would be no help for them, no way to get out and access the help. So that's the primary difference. And so I think if you've had a lot of anxiety and had anxiety attacks, again, it's best to get some help with it. But I don't think you have to worry that it means you will have a panic attack. It's not necessarily true.
Yeah, that was another question. The question was that, does another panic attack is likely to occur when after having one particular panic attack? So is it likely to, a person is likely to have another one?
Yes, I think so, because again, there are some underlying issues. I mean, a panic attack comes out of nowhere. You're not expecting it. Nothing in particular seems to prompt it. However, when I work with people who've had panic attacks, one of the things we'll do is we'll go over the things that are going on in their life, and we'll actually identify that there are a lot of stressors. There are I, a big thing behind panic attacks are what we call in the United States cognitive distortions. But these beliefs
Hmm.
that we have about the way life should be, or about the way I should feel, or all these kinds of things, and so sometimes that's part of the treatment, is that if you talk with someone about your panic attacks and the circumstances around them, you can start to make changes to your life and to your belief system that prevent you from having another one. If you ignore a panic attack, you may never have another one. As I said, most people that have panic attacks have one or two. And so it's not necessarily something you need to be worried about. However, it is sort of a wake-up call to try to find out more about the overall stress and anxiety of your life.
Exactly. Okay, so coming to the next question, what are the causes of panic attack and anxiety attacks? So, are they, genetically caused or hereditary or environmental stresses? What are the causes?
Well, one of the reasons anxiety is probably on the rise, um, which it certainly is in the United States, is because many factors. I mean, there is a genetic component.
Hmm.
There are differences in our brain functioning and neurochemistry. Every individual has differences there. Overall, though, there's everyone is experiencing more anxiety because of many factors. We can reduce levels of anxiety and our vulnerability by spending time outdoors, and we spend more and more time indoors. We need a lot of exercise to help with that, and we see less and less of that. Even schools tend to focus so much more on academics that the kids aren't getting as much time for recess, to be outdoors. And even when you're doing anything creative, that's an alternative to stress whenever you're so children having art classes. So that's another component. Um, Also, sleep is a big issue, and the more we're all striving to accomplish more, and this sense of competition makes it harder for us to, make sure we get enough sleep. So these are underlying causes. I think another one is nutrition. Not getting at the more you eat processed foods, the more vulnerable you are. So I would say that, like, if you had a panic attack, that doesn't mean you'll necessarily have another panic attack. However,
Hmm.
if you don't have a healthy lifestyle, that would make you more prone to a panic attack. So the underlying causes are, the type living a very fast paced, demanding life without time for healthy habits, and a lack of balance.
So basically, I think here comes the role of parenting as well. As a kid, some parents are very much dominating, they're authoritative, and they're just pressurize their kids. They blame them for their failure. So I think somewhere this is also acting as a factor towards these attacks.
Yes, that's right. Because again, going back to like cognitive distortions, the beliefs that we have in our head. If you have a parent who has high expectations and expects you to always succeed, and has a hard time supporting you when you fail, that can add stress to a child's life, and that's hard. And I'd also say, now that you bring up the parenting, that use of technology, that's also another reason why we're having increased levels of stress. The pressure of social media that increases the amount of comparing ourselves and our lives to the perceived lives of others that people put on social media. And also relationships, quality of relationships, both with parents
Mhm.
and family members, but with friends and with others. I mean, the more we are relating to people online and not in person, that causes stress.
Exactly. Exactly. And the thing how social media portrays things on this platform also has a very big impact on their mental health, because on social media it is really very much imagery and very much edited and scripted, but people take it on themselves. They take it like they are just a failure and they are nowhere equal to them, and this also impacts a lot.
Yeah, it's so difficult. I can't imagine, growing up with that kind of pressure. It's hard. And
Exactly.
the upside though is that with social media there are things like this that I think are nice. And again, it's all about balance, right? So if social media is out there and causing stress for people, programs like this are the balance to that, and help people remember, because we need constant reminders. We all know social media is very scripted, but we need to hear it on a regular basis because it's easy to forget.
Exactly.
Yeah.
So here comes a question from a mental health professional, that what kind of therapies are more effective on treating these panic attacks? Which are the therapies which are more effective? So all the mental health professional, here's the answer.
Well, so first I'm gonna just say that if you seek help for panic or for just anxiety, the most important thing is to find someone that you're comfortable with. All the research on the effectiveness of therapy goes back to whether or not you feel safe and really listened to and understood by a therapist. So that's number one thing. So, it doesn't even matter what your therapist, whether it's a psychologist or it's a mental health counselor, it's really about finding someone that you have a good connection with, that you trust enough to really be open with them. So that's the first thing. Then secondly, I will say that it's really important to be curious and to be open about really thinking about the things in your life that have been hard for you. So in that sense, that's sort of a psychodynamic approach, that you are kind of looking at the way past experiences in your life may have led you to believe certain things that then make you more prone to panic, or prone to feeling anxious. So that's sort of a psychodynamic approach. So that though doesn't need to be done in a deep psychodynamic traditional therapy way. It can kind of be done through just, talking it through, exploring and making connections. Probably in terms of empirically validated treatment, cognitive behavioral therapy is sort of seen as one of the more effective ways to treat this. And again, it's because when you panic, although it seems like it came, if you have a panic attack, it seems like it came from nowhere. However, there was something that prompted it, because your body doesn't just go haywire. There was a sight, a sound, a smell, or a memory that came to you that caused it. And so you want to get to like what that was, which is a little bit more investigative. And then you want to try to change the thoughts that you have so that the next time you encounter that trigger, you don't immediately get this. Because when you have a panic attack, you're actually talking to yourself to some degree, and you're saying, oh my gosh, this is terrible. You're reacting to something. And so it's both identifying what you're reacting to, even though you don't think you know what it was, and also changing your self-talk to some degree so that you respond differently. So again, but the most important thing is just find someone you feel like can help you, because a lot of it has to do with just you being able to talk freely and openly so you can explore. Because I like to tell people that, I'm here to help you, but you have the answers. I don't. I'm just going to help you find those answers within you.
Exactly. So basically, which therapy do you prefer? Means which therapy do you apply mostly? CBT.
So one of the things I appreciate about being a psychologist in the United States, we have the luxury of at least 4 years of education. So you get exposure and training in family therapy, systems therapy, industrial. You get exposure to all of them. So I'm very eclectic. However, I will say that um, I'm very interactive and very curious and inquisitive. So I'm much more likely to start with a CBT approach, even though I do think it's important that people realize that some of the beliefs that we have, they're not even beliefs from our own childhood. Some of them are beliefs that our parents or our grandparents or our great grandparents had about previous life circumstances that we're still holding on to. So that's a psychodynamic kind of approach. But I'm also what you would call very much a relational therapist. Like I said, I really believe that you have to be there for the person and follow their lead. So I don't think I actually don't think anybody practices completely one type of approach.
Exactly. Eclectic approach is the best one. Okay.
Yeah. And I think that's one of the reasons why you need to work with someone that feels comfortable, because someone that you think can really help you will adjust for you. If I have someone who I know CBT is going to be easier for them to understand, or that's a better way to explain things or address things, then I'll do that. Whereas someone else who wants to share more about their feelings, I'll make an adjustment accordingly.
Exactly.
Mm-hmm.
Okay, so coming to, I want you to share some of the cases which you want to share with us, share with the audience, your experiences with the people who suffer from panic attacks or anxiety attacks. Any of the cases you want to share?
Sure. Again, it's kind of hard to share because I've worked with people who, as professionals, they might be like a lawyer and they're about to go into a courtroom, and all of a sudden they're having a wave of anxiety and find they need to go into the bathroom and just calm themselves down. And one of the things about panic attacks is, and if they can get away and isolate themselves from the stimulus, most people they will, even though they're intense, they'll pass fairly quickly. So that's helpful, and that's why there is a lot of panic about having a panic attack and not being able to go someplace where you can just kind of regroup and get your bearings back. So I've had people who've had that. I've had medical doctors, I mean more than one, who have panic attacks. So they'll get through a very grueling workday and they'll get in their car and just have this sense of impending doom, and just comes from nowhere. I myself, I think I had a panic attack. I was trying to read bedtime stories to my two younger brothers, and they weren't going to sleep, and all of a sudden I just had this panic, and I think again it goes back to like cognitive distortions, and I just thought, I think I panicked and thought, well, I'm really going to be in trouble now, and how come I can't get them to listen to me, and I'm such a failure. And that's what you're really responding to, are the thoughts in your head. And so that's what I would say with all of my clients. What I help them do is start to realize, like, well, what's happening in your head at the time? It doesn't matter what the trigger is. Like I said, it could be a sight, a sound. Someone might look at you funny, and all of a sudden you're feeling a wave of panic. And it's really about, well, what's going on in your head? And this is where my mindfulness and meditation training, I try to share that with people and help them realize, like, even if you're feeling anxiety on any, I mean, it's a spectrum, right? Low level anxiety to like intense. Just, if you can pause and just take a deep breath and just ask yourself, like, okay, just do a reality check and see, like, if you're in a safe environment, you just need to be reminded of that. Because what happens is we go in our head and then we're off and we're imagining all kinds of things. And that's when the symptoms really intensify. So,
Exactly.
it's hard to describe examples because they're really random, but they happen anywhere, anytime, any place, and there's no level of education or anything that it affects everyone.
Exactly. So, are there any kind of medications which can, control panic attacks, or just therapy works?
So that's a great question. And when I deal with people that come, if they've been having, if you struggle with anxiety on a regular basis, there are some really good medications you can take every day. In the United States, we have what are called the SSRIs, and they just help increase levels of serotonin, which are very helpful. And as I said, it's very real. Some people cannot help it, no matter how much therapy they do, no matter how much yoga they do, or healthy lifestyle. You can actually just have a neurochemistry that's not it's just the same as you could have, differences with if you're diabetic and you have to look at your glucose levels, or you could be asthmatic and you just need to have an inhaler at certain times. There are people who just it is very real, and so those medications are helpful. They're usually antidepressants, but they help a lot with the anxiety. If you are experiencing, or if you've had a panic attack, or if you're having a lot of anxiety attacks, sometimes you can get what we call a benzo. It's an anti-anxiety medication that's fast acting. You take it only when you need to take it. You don't take it on a daily basis. Doesn't prevent anything, but it helps if you, just like a pain medication helps if you're having a headache. So there are those medications.
Painful.
And if I'm working with someone who's had a very bad panic attack, like has gone to the hospital, and they're really anxious about having another one, I'll say to them, you really should consider taking a medication, just to prevent your anxiety from getting worse, just to prevent a panic from becoming a disorder, because it is intensely anxiety provoking to think, oh my gosh, that could happen again at any time, any place. That in the beginning, before you really start to understand what's happened to you, it's very frightening. So those medications can make a huge difference from preventing one experience from becoming a bigger problem. So I'm glad you asked about medications. They're really important.
Okay. So, I want to ask you that what are the changes a person can make if he or she has moderate level of panic attack or anxiety attack in their life? So, what are the changes they can make in their lifestyle so that to get to a mental well-being state and don't face these type of issues further in future? So, are there any tips?
Yes, so there's a lot of things you can do. Again, they're the kind of things that you want to do to keep yourself physically healthy too. So again, what you eat every day makes a difference in your stress levels. So it's what you eat, it's how much sleep you're getting, whether or not. One of the best things you can do for any kind of mental health issue is exercise, physical exercise. I mean, the body produces drugs itself, and so that's one of the key things. But there are other things too, which are just learning to take 5 minutes for yourself to just catch your breath, just building into your day some little breaks, you know what I mean? And to just make sure that you're just slowing yourself down every once in a while, and catching your breath. Having a hobby is really helpful, because if people that have a hobby, whether it's painting or photography or some outdoor activity, gardening, those people, what they're doing is when they're doing that, they're taking a break from the mental activity. When you're doing something like that, you're focused on something creative, and you're not experiencing the same level of performance stress, related to, because you're gardening for yourself, and so typically having a hobby is a nice way to give your physiologically, you give your nervous system a break when you do that. Meditation is another way that when most people start, and myself included, when I started, all I did was sit there and say, well, I'm restless, it's hard to sit still. I mean, and when I complained to, my mentor, she was like, well, just sit there with your restlessness until you get comfortable with that. So it's about just learning how to slow down, which in the beginning feels difficult.
Yeah,
But also having relationships is really important too, you know.
exactly. Healthy relationships.
Healthy relationships, yes. Yes, because actually that's one of the key stressors for people is they'll be in a not so healthy
Exactly.
relationship, and that actually can cause, you can have chronic anxiety if you're in a relationship with someone that causes you to doubt yourself on a regular basis, someone who, is
It's
communicating to you.
toxic.
Toxic, exactly. And so sometimes that I've had clients who've come to me and they've had a panic attack or they're really struggling with anxiety, and over a period of time, you know, they've come to realize that they actually are in a toxic relationship, and they didn't really realize it because the relationship was so familiar to them that until they came and talked it through with the professional, it wasn't clear. And so that's a big part. So I'm glad you brought that up. Good point.
Yeah, actually, the thing is, I have come across various clients who are just being attached to a person because they have been in a relationship for a very long time. So they are just dragging that relationship just for the sake of the time they have spent. So they are not ready to understand that that relationship is toxic because they have spent a lot of time with that person, and this new person he or she is confused with is not at all good for him. So there is a lot of problem with adolescents because they are just stuck with the person whom they think that this person I have been in a relationship with 6 years 7 years, so he cannot be toxic. So they just give stress to themselves, it affects their mental health, and they just move on and they don't realize it. So it is really very important to take this topic.
Yeah. No, it really, really is. And I think the thing is this is that one of the things that we have the most anxiety about is change. And so
Exactly.
so you might be in a relationship that you're not, it's not, doesn't feel like it's really good, but it's scarier to think, and you can have more anxiety about, well, what would my life be like by myself? Or, what would like, so that's another common reason why we have a lot of anxiety is that, things are changing or we need to make a change and it feels so frightening. The unfamiliar and the unknown are really anxiety provoking.
Exactly. This is what I wanted to say. This is something very, very important, and which is a major cause of giving anxiety to people. Okay, so I think I am done with all the questions. And if people who all are here live with us, you can all ask us whatever you want to ask. There are 7 people, 6 people. So, guys, you can ask us. We are here.
Mhm.
We will wait for 2 minutes. Otherwise, we will end up this session. Okay. How can I get consistent behavior? One strong tip, please. I think he or she is talking about dedicated behavior or something like that.
Okay, so maybe is the question, if trying to address your anxiety, trying to make change in behavior, how to make it consistent.
Huh.
So
Yeah,
so if you're talking about how to get consistent behavior that would help reduce your stress and anxiety, I'll say one of the things that is tied into my mindfulness meditation training is compassion, having compassion for yourself. So if you're trying to do something, like say you're trying to like get more sleep because sleep would reduce your stress and anxiety, don't beat yourself up and criticize yourself if you're not doing a good job. Like if you're trying to say you sleep 6 hours a night and you want to sleep 7 hours a night, just be supportive of yourself and give yourself plenty of chances. Say, okay, well, I'm going to try again and try that, because a lot of our stress and anxiety, again, comes from toxic relationships. And very often we have a toxic relationship with ourselves. Very often what we say and how we comment on ourselves is toxic. It's not helpful. We are often the first people to say something negative or judge ourselves or be critical. So if you're trying to do a new behavior, I know that's essential if you're trying to develop a meditation practice. It's important that you start and make it easy. Start with 5 minutes. And like I said, when I started meditating, I sat there thinking, like, I don't have time to meditate. I've got so many other things I want to do. And I'd sit there and I'd plan and I'd think about everything else. And the way for me to get past that was for me to be compassionate and say, it's okay to sit here and be restless. It's okay to sit here and be distracted by the things I want to do. That's okay. And the more I told myself, I was very gentle, it allowed me to keep going to a point where now that's not such a problem for me anymore. So if you're trying to establish a new behavior and want to maintain it, I would say make the goals small and reasonable, and give yourself time and be kind to yourself. Don't get, treat yourself like you would a friend. Be encouraging and supportive and understanding. That could help a lot.
Exactly. Ma'am, here's another question. Someone is asking that which university will you suggest to pursue PhD from abroad in positive psychology?
Oh gosh, I wish I knew more about that. Again, I'm in the United States, and there are so many programs in the United States. So abroad, I don't know, but I do believe that most graduate programs are what we call accredited. And so I would think that anything that has the accreditation of an educational, committee that oversees the standards would be worth pursuing. And I think again, the wonderful thing about the internet is that you can learn a lot about that by just reading up on that. I don't know that there's a key program. I can't even tell you that there's one program in the United States that I would recommend over any other. Like I said, I think they're all accredited, and you need to learn a set of basics no matter where you go. So again, I think it's the other thing too is that people that make good therapists have a certain personality and a nature to them too. So if you're inclined that way, then you just need to get the information, the knowledge, wherever it is convenient or easiest for you. Because I think you can do this work if you need to have a certain level of being like attuned to people. So look around, educate yourself a little bit, but then find a program and just move forward. That's what I would say.
So here is another question. So Ria is asking, what if the time is getting exceeded and we still couldn't find satisfaction with what we are doing or couldn't improve?
Then try something else. Be open-minded. If you think that maybe you need more sleep and you've been trying that and your stress levels don't go down, then consider maybe I need more exercise, or maybe I don't need more sleep or exercise. Maybe I do need to learn something completely new, like how to meditate. Or maybe I need to spend time doing a hobby. Or maybe there's a habit that I have that I don't need to do anything new or different. I just need to stop doing something I've been doing. A common one is watching the news before you go to bed. Like, so again, I encourage you can even go and see a therapist for 1 or 2 or 3 sessions. You don't have to make a big commitment to go. You can go and have a consultation with someone. These are really good questions, and you can talk these through with someone who might be able to help you think of something you haven't thought of yet on your own, because there are a lot of different factors. And we will all consult professionals for so many other things, and I think it's just people don't automatically think you could get a consultation on your mental health. It feels like you really have to be in crisis, or you'd have to be very sick to have to, go to a therapist or something. And then that's not true. It's actually a really good, constructive thing to do. So yes, be open-minded. If something isn't working, be nice to yourself and give yourself time, but then also be open-minded and consider exploring other options. So
Exactly. So Yeah, you can say. So basically, adding to this, as I always say, that whenever you set a goal, it should be first realistic. Plus, you should be always flexible to it. Never be rigid. Always stay open to many other doors. There are a lot of doors you haven't seen it yet. So your vision is just this much, but you have to see 360-degree. So basically be flexible. And I would also suggest that when you make plans, if you have made plan A, B, C, then make a plan D as well. If A doesn't work, B doesn't work, C doesn't work, D will definitely work. So always, as ma'am suggested, stay open to everything, every opportunity.
Well, and
So
this is
guys,
oh, I was just going to say, and
yeah.
this is where relationships are important too, because if you share with people close to you that what you've been trying, sometimes they'll have an idea too. And we don't always think to tell people about our struggles. And other people, if you open up, they might be like, oh, that's happened to me too. And this is what I tried. And then, so there's plan E.
Exactly. And here with friends, the idols model, role models in your life also works well. If you are having goals according to your career, regarding your career choices or anything like that, and if you have a role model in your life, so you can just go to them and just ask them that I have this problem, how to deal with it. So they will guide you because they are specialized in that particular career from earlier stage. So basically it is really very important to stay tuned with your friends, close ones, and your role models. So if anyone has any other question, okay, what if the time, okay, we have answered to this question. So guys, any other question? Otherwise we will just end up this session. If you have any other question, you can ask. Okay, I think that's it.
Sounds good.
So
We covered a lot.
Can you hear me?
Yes.
Okay. I
I was
think
just saying,
connection.
I think we've covered a lot. So I think it's
Yeah, exactly. Exactly. So yeah, I think we have answered to all your questions, and yeah, I think we should end up this session. Thank you so much, Dr. Cronin, for joining me, for collaborating with me, taking your time and talking about dealing with panic attacks. Thank you so much. This is something really very special because I have done live a lot of time and I have collaborated with a lot of people. This is my first series which I have started from my page, and in which I am collaborating with different people, and this makes more special because I have you for my first episode. Thank you so much for taking your time and joining me.
Well, I look forward to when you have me back again for your 100th.
Thank you so much. Okay guys, so I think we should leave. Thank you so much, ma'am, for joining here, and now I am ending up this session. So yeah.